A thorough head and neck examination is essential for detecting early skin cancers and enlarged lymph nodes that may indicate cancer metastasis or the spread of cancer. In addition to cancer, manifestations of systemic disease may be observed during routine dental and oral examinations. In patients with Alzheimer's disease, there are several oral findings due to improper maintenance of oral hygiene as a result of the failure to remember its importance, an incorrect control of bacterial plaque, the presence of xerostomia or dry mouth, and manifestations derived directly from medicines. The deficiency in the oral hygiene patients with this disease can trigger a number of dental problems, which include caries, periodontal disease, gingivitis, halitosis or bad breath, and a progressive destruction of teeth, which can eventually cause systemic consequences, such as difficulty to feed themselves adequately. Before beginning the extra and intraoral exam, you want to make sure that you're wearing the proper protective equipment. This includes safety glasses, a mask, gloves, a gown if available, and if your hair falls over your shoulders, make sure to tie it back. If your patient wears any type of glasses, ask them to remove them. To begin, discreetly observe the patient for facial symmetry and profile type. Obvious asymmetry may be a red flag for neoplastic growths, muscle atrophy or hypertrophy, and neurological problems. You will now check for patient mobility of the eyes and neck by asking them to move their necks to the left and right and their eyes up and down and left and right. Then you try to reveal the sternocleidomastoid bone by asking your patient to turn to the left and right by looking down, and you will palpate bidigitally. Here you'll be looking for any enlargements, bumps, or lumps. Then you'll move on to the thyroid gland for any asymmetry and abnormal enlargements, and then ask them to swallow to check their swallowing and gag reflexes. You will then move behind your patient, place both hands on their temporomandibular joint, and ask them to open and close to check for any discomfort, pain, or restrictive movements. You will then palpate or move your fingers in a circular motion to check for any lymph node swellings in the back of their neck and ears. You will then ask the resident to lean their head back into the chair, if possible, to check additional lymph nodes located underneath their chin area by moving your fingers in circular motions and pressing upwards. If no significant findings were noted, the extraoral exam is complete and we will move on to the intraoral portion. Make sure to change your gloves and ask your patient to put their glasses back on or provide them with safety glasses. You will need to make sure to have gauze available. We will start by examining the resident's oral mucosa or the skin lining their lips and cheeks. You will observe, dry, and observe again, and end by palpating bidigitally to check for lumps, bumps, or any unusual swellings and pain. While you are observing, you are looking for unusual growths, discoloration presented as white or red. You will need to remember that there are normal findings that present as white in our mouths due to hyperkeratinization of our tissue, so you will want to establish a baseline with each resident. If the discoloration grows or changes in shape, you will want to refer. Now we will move on to one of the strongest muscles in our body where the first signs of oral cancer tend to manifest, the tongue. You will take the resident's tongue in a piece of gauze and check the lateral borders for any discoloration, growths, or ulceration. Like everywhere else, the tongue will also need to be palpated bidigitally. Ask the resident to place their tongue on the roof of their mouth, if possible, and observe. Bimanually, you will then palpate the floor of the mouth. One finger will be inside the mouth pressing down, and the other hand under the chin pressing upwards. You will then take your finger and run it along the vestibular area. This is where a lot of food tends to get stuck, causing irritation to the gums and sometimes even fungal infections. You will also need to palpate their gums bidigitally and ask if there is any present pain. Lastly, ask them to stick out their tongue and observe their tonsillar area for redness or inflammation. And also remember that while examining the intraoral tissues, to keep an eye out for poor salivary flow and dryness, as this too can cause fungal infections, irritation, and increase their chances of having periodontal disease. Now we'll discuss toothbrushing. If the caregiver is brushing the resident's teeth, it is always better to use a powered toothbrush. If the resident is still able and wants to brush their own teeth, they can use toothbrush holders to help with some of the dexterity difficulties. You will need some toothpaste and a soft bristle toothbrush. Apply a generous amount of toothpaste onto the toothbrush, stand behind the patient, and spread the toothpaste onto their teeth. Now you'll angle the toothbrush at approximately 45 degrees towards the gums. Then in small circular motions, begin to brush all surfaces of the teeth. This will ensure that you are cleaning underneath the gums where a lot of food and debris is compacted and bacteria builds up. If you are unable to use a toothbrush, at least make sure to go in with a piece of gauze into the vestibules to remove any leftover food and debris. This can be done immediately after meals to ensure that the resident does not aspirate or choke with any leftover food particles. Lastly, you want to make sure that the tongue is also scrubbed and brushed. If the toothbrush has a built-in tongue scrubber, use it. If not, the bristles work fine. Just make sure to watch out for any gag reflexes. Now we'll discuss denture care and denture placement. The Polydent Complete Care Starter Kit for dentures and partials includes Polydent cleaning tablets, Polygrip adhesive, a soft denture brush, a water bath, and an instruction manual. First, fill the water bath with enough very warm water to cover the denture. You will take one Polydent tablet. Make sure the resident does not place the tablets or the solution into their mouths. The tablet will be dropped into the warm water, and while it is fizzing, drop the denture in to soak overnight. After soaking, remove the denture from the bath. Rinse with warm water and dry. If debris is still present, brush the denture with the solution using the soft brush that was available. Then discard the solution after one use. And once again, rinse the denture with warm water and dry thoroughly. To apply the denture, they will need to be clean and dry. You will use the Polygrip adhesive. Do not use too much adhesive that it will ooze out. Apply the adhesive in short strips. Rinse the resident's mouth before placement and then press the dentures into place. You want to hold firmly and ask them to bite down for a few seconds for a secure hold.